You've tried the medicines, you've tried IUI, your all reports are normal, you maybe haven't even tried IVF, but still you are not conceiving. What if I tell you a common item on your plate called roti, bread, chapati, whatever you might call it, could be hindering your chances of fertility outcome, could be preventing you from becoming pregnant. Millions of people in this world suffer from gluten intolerance or sensitivity to gluten without even knowing it. Can the autoimmunity triggered by gluten, the inflammation because of gluten, or the nutrient deficiencies because of the malabsorption as a result of gluten intolerance be the cause of an impediment to your fertility outcome? Hi, I'm Dr. Rajat, and in my years as fertility specialist, I have seen couples struggle with unexplained infertility. Apparently, every possible report is normal. Their laparoscopy is normal, their HSG is normal, their husband's semen analysis is normal, and apparently even the hormones are normal. Still, they struggle to conceive. Yes, gluten, a very common item on your plate, may be responsible for it. Recent reports suggest that gluten intolerance, gluten sensitivity, or more specifically celiac disease might be a factor which may lead to the impaired or in adverse outcomes, reproductive outcomes in both males and females. In this report, we'll discuss about very common, very less aware topic called gluten intolerance. What is gluten? Why one should not eat wheat? What are the symptoms of gluten intolerance and why the awareness is very, very less? What are the treatment of gluten intolerance? How does this gluten affect the body? How does this gluten affect fertility outcome? How to diagnose this gluten intolerance, or what is the treatment of this gluten intolerance? Hi, I'm Dr. Rajat, and you have started watching our YouTube channel, The Fertility Gynecologist. This is the topic I'm very, very, very passionate about. About a decade back, I happened to read a book called Wheat Belly by Dr. William Davis. He's a famous American cardiologist. He wrote a book called Wheat Belly, Lose the Weight. Lose the weight and lose your weight and get back to your path of health. He said very few interesting observations. According to Dr. William Davis, wheat raises more blood sugar than a Snickers bar. Wheat is one of the foods with highest glycemic index. Because he was a cardiologist, most of his patients were either heart patients or diabetic patients. He once happened to suggest them to get off the wheat. And the results what he found were very, very, very amazing. Not only did the blood sugars improve, patients lost weight, their inflammation decreased, their cardiac problems, their cholesterol levels decreased. Even the problems such as arthritis, asthma, irritable bowel syndrome improved. There was a disappearance in the leg swelling and the numbness. He attributed all these symptoms relief to a major factor called as gluten, which was absent from the diet once the patient stopped taking wheat. Gluten is, however, only one of the proteins which is present in the wheat. There are about more than 10,000 other proteins. Why wheat is harmful? Because wheat contains a protein called as gliadin, which acts as an opiate in the brain, and it releases a protein called as hexomorphin, which helps us eating more and more and more. Wheat causes us to get addicted to it so that we eat more. According to a report, patients who eat wheat, because of gliadin, they eat more than 400 calories per day. And interestingly, a company even filed a patent in 2011 to treat the wheat addiction by the use of a naltrexone. Yes, naltrexone is an opioid blocking drug for weight loss. Interesting, isn't it? This gliadin protein has been demonstrated to increase the small intestinal permeability and thereby permitting the entry of polypeptides, antigens into the bloodstream and the lymph nodes, which is first step in generating on autoimmunity. This is very, very important point. People do not understand. Whenever I tell them to not to eat wheat, they say, sir, we have been eating wheat for the time immemorial. I'll come to it later on in the video. We have not been eating wheat since time immemorial. Our human civilization is only about 10,000 years so long, but we have been there since millions of years. Problem is, at the beginning of 20th century, the agricultural scientists, the agricultural business, they did something called as GMO. Wheat was the first GMO food, genetically modified food. They wanted to make wheat which is pest resistant, drought resistant, and disease resistant to increase the yield of wheat per hectare. And in the process of that wheat, they hybridized the wheat. They genetically modified the wheat. They modified the genetic code of wheat. And as a result, gluten has come into the wheat. Gluten is not meant for human consumption. It is meant for consumption of grass grazing animals. The increase in incidence in last 50 to 70 years is because of the enrichment of a glia alpha 9 gene in modern wheat, which was virtually absent in the wheat before about 50 to 70 years. Problem is not only with the wheat. Problem is the way we consume wheat. Wheat is one of the most processed foods, and the way we use wheat has changed drastically over the years. Gliadin acts as an appetite stimulant, and that is where all the big pharma, agricultural industries, the food companies take advantage, because it stimulates your appetite. The more you eat wheat, the more you want. And that is why the food companies have found a way to put wheat flour or maida in almost every damn item imaginable. Imagine you find wheat flour even in tomato ketchup, tomato soup, even in the gravies you use. Like I mentioned, this gliadin contains a protein called as an exomorphin, and these compounds, they lead to this addiction. As long as wheat remains a part of your diet, you will not have full control of your hunger, and that is why the incidence of obesity, the silent epidemic, or as I call the slow pandemic, is increasing nowadays. Because of this wheat in our diet, we are tend to eat more and more. There is a difference between hunger and satiety. We eat till our satiety. We do not fill our physical hunger, the hunger. That is a difference between, and the wheat increases your satiety level. So you tend to eat a couple of chapatis more even if you are not hungry. Wheat, my friends, is a weak opiate. It is a Trojan horse which contains gliadin protein hidden in it. We eat more, we gain more weight, and all the consequences as a result of the increased weight, like hypertension, diabetes, and the inflammation related disorders. Wheat causes the occurrence of something called as a gaining of weight in the middle of your belly, the paunch. That is why it is called as wheat belly, and that belly becomes the hotbed of inflammation. People say that they want to reduce the abdominal wall fat, but they find it very difficult. I say decrease or avoid the wheat, and you will find it very easy to reduce your belly. Imagine even 2 slices of whole wheat bread is equivalent to the sugar, which is higher than a amount of sugar which you found in a Snickers chocolate. Wheat is one of the most high glycemic index foods. That is why the patients who stopped eating wheat, according to Dr. William Davis, they lost approximately 15 to 20 pounds. They lost 4 to 6 inches from their waist. They experienced complete relief from their acid reflux, from their heartburn, from irritable bowel syndrome. Even the arthritis, joint pain, and various skin disorders were relieved. Even the frequent occurrence of the skin infections, sinus congestions, were relieved. You must be wondering how these varied symptoms can be happening from the avoidance of wheat. I'll come to it later on. The thing is, the wheat avoidance is not only for the gluten sensitive people. It is for everybody who is interested in regarding the control of their health and weight. From years, we have been fed that the cause of heart disease is oil, fat. Fat is what makes you fat. On the contrary, it is not fat which makes you fat. It is wheat, my dear friends. Yes, wheat, the grain which you've been eating since childhood, the rotis which your mom, which your parents have been giving to you. In my belief, it is not a good thing. It is a slow poison. Wheat contains amylopectin A, which leads to the increase in amount of LDL. Also, it contains gliadin, which triggers the inflammation. Inflammation, it increases your paunch, the belly, and this belly is a hotbed of inflammation, which leads to hypertension, diabetes. It even leads to everything related to the inflammation. And as we understand our body more and more, as we understand diseases more and more, inflammation is the factor to trigger almost all the diseases, be it blood cancer in the body, or the brain stroke, or the heart attack, everything. So the moment you stop taking wheat, not only your sugar drops, your inflammation decreases, your blood pressure decreases, and you become healthy. I'm talking so much about gluten, you must be wondering, what is this gluten? Basically, this gluten of 20th century is different from the gluten of 19th century, the wheat of 19th century or wheat of 18th century. Gluten is a protein which is not meant for human consumption. It is found in wheat, rye, and barley. Please remember these things: wheat, rye, and barley. So anything made from wheat, it contains gluten. You can find gluten in many ways. It is found as a stabilizing agent in various gravies, thickeners in ice creams or ketchups. You can even find gluten in the cosmetics like lip balms, lip gloss. You can find it in beverages. You can find it in bread, cereals, pastas, pastries, desserts, packaged foods, sugars. You can find it in ice cream cones, mayonnaise, pancake mixtures, dumplings, waffles, biscuits. You name it and you find the gluten there. You can even find it in various Chinese foods, gravies, soups, thickeners. Even the wheat germ oil, which is used as an emulsifier in the cosmetics. It contains glutens. The breadcrumbs which are used in the favorite paneer chili or in the pakoras, they contain glutens. So basically, gluten is everywhere. Like I said, food companies have found a way to increase your appetite, to increase their business, and that is why gluten is everywhere. So where do you find the gluten-free diet? Basically, gluten-free diet rules out all breads, pastas, and convenience food. The burgers, the Chinese, the Italians, the noodles, the pastas, the cookies, the pastries. I say in Gujarati to my patients, gaun, maida, मैदाથી બનેલું ટોસ્ટ, બિસ્કિટ, પિઝા, પાણીપુરી, સમોસા, ફરસાણ, મેગી, પેસ્ટ્રી, કેક, બ્રેડ, પાસ્તા, નૂડલ્સ, burgers, they should be avoided. There are natural gluten-free fruits, however. Fresh meat, cheese, paneer, eggs, milk, fruit, vegetables. Even the starch is made from maize, potato and buckwheat. They are gluten-free. But problem with them is they are low fiber. And gluten, which is used as a stabilizing, as a binding agent, it usually rises on baking. These things, they do not rise on baking. The gluten-free, many companies have come up with the gluten-free label. You go in West, they are very, very particular about the gluten-free. In India, the awareness about gluten is not there much. So any item should have at least less than 20 parts per million of gluten for it to be labeled as gluten-free. Many people question me, can we eat oats? Well, technically, oats is gluten-free, as I'll allude to it later on in the video. You should not eat more than 50 grams of oats per day, because the milling, the baggaging, the packing facility, the transport facility is same as that of wheat, and there is a chance of cross-contamination with gluten of oats. So I would strongly urge to avoid the commercial gluten-free foods, because in order to avoid gluten, they use the starch from other sources, rice starch, potato starch, which although it prevents the gluten, but it increases your blood sugar. Agriculture is only 10,000 year old, our human civilization. Civilization means we started living at a place and we started cultivation only 10,000 years back. Before that, we were hunters and gatherers. We used to eat plants, tubers, meats, high quality proteins like fish. We rarely ate grains. We are not meant to eat grains. We are not evolved to eat grains. Unlike the animals, we only have one stomach. And when the undigested wheat goes into the stomach, it can cause fermentation, gas, bloating, and discomfort. The wheat which we eat now is not what we used to eat till about 100 years ago. It has got more than 40% proteins, what it was earlier. It is a genetically modified version of the protein. And we human beings are not metabolically equipped to eat wheat and excess amount of starch, which unfortunately since last 50 to 70 years we have started eating. We consume too much of bread, cereal, pasta, and this increase in starch and wheat causes insulin resistance, which, my dear friends, is the most important point to cause all the diseases. Reality of bad food is not fat, but it is the excess carbohydrate which causes you to be unhealthy and overweight. Wheat, like I said, is one of the most processed food. Even white vinegar is processed with wheat, and almost all the condiments and spices are processed with white vinegar. So it is very difficult to be gluten-free. Wheat, if I may say, is like a Velcro on your gut. It basically sticks to your lining of the gut, and it is very hard to get digested. Is it only a coincidence that the incidence of celiac disease and infertility has increased in last 50 years? In fact, every 15 years, the incidence of celiac disease doubles. It is more than 1% of the population which are affected by the celiac disease, and almost more than 40% or every 1 in second in 2 individuals has got gluten sensitivity or gluten intolerance. The problem is gluten is in everything. We are eating more wheat in the history than ever before because bread are the most convenient food. As a society, we want to eat nice, fluffy breads which rise on baking, and we still add more to make it rise. Have you ever wondered why you have a slight headache or migraine after you eat something of wheat? It might possibly be because of the gluten. I've said so much about gluten. What is this gluten? Gluten is an elastic, rubbery protein which is found in wheat, rye, and barley, and to a lesser degree in oats because of the cross-contamination. It is used to bind the dough so that the dough binds. It is used to find that consistency, that spongy texture which rises on baking. Celiac disease, yes, it is diagnosed by a villus atrophy along with the symptoms. But almost nobody tests for non-celiac gluten insensitivity, which is what I am concerned about. 40 to 50% of the world suffers from non-celiac gluten insensitivity. And most of the people spend their lives thinking that their symptoms are not tolerable. This gluten allergy or gluten intolerance symptoms are misdiagnosed, and even if they are diagnosed, they are treated for some medicines to suppress the immune symptoms rather than treating the cause. Technically, celiac disease is not a disease, it is a severe reaction to a specific type of a foreign protein in our body that is called as gluten. 40 to 50% of our population in this world is gluten sensitive, and about more than 1%, that is 1 in 133% to be precise, are suffering from a deadly disease called as celiac disease. There are more than 100 to 200 symptoms which are attributed to the gluten. Gluten acts as a toxin to many people. It erodes and damages your small intestine, and as small intestine is responsible for turning the food which we eat into fuel. The moment villus atrophy or the erosion of small intestine occurs, that food is not converted into the fuel, the nutrients are not absorbed. As a result, most of the people suffer from malabsorption syndrome. Why vitamin B12 and vitamin D deficiencies are so common nowadays? Did we hear about these deficiencies still about 50, 70 years back? The answer might be well into the gluten. It damages intestine because of gluten not only cause malabsorption, but it also causes something called as a leaky gut. The intestines allow the passage of the polypeptide proteins. But why the symptoms of gluten are not specific? It is because different people react to differently to the gluten. One person may have something called as an irritable bowel syndrome, some may just be exhausted or stressed, while other may have thyroid problems. Because celiac disease is an autoimmune disorder that develops in a genetically susceptible individual when an environmental trigger like a gluten affects it. It is a multi-system disorder, and that is why we see the symptoms which are varied. The symptoms are over a spectrum. The mild symptoms are gluten sensitivity, and the severest symptoms are celiac disease, and everybody is on a continuum of a spectrum. What the physicians or surgeon call as irritable bowel syndrome, I call them as gluten intolerance. There is no test currently to diagnose gluten sensitivity. I will come to it later on. But gluten sensitivity is 10 times more common in people rather than celiac disease, and that is why it is my topic of concern today. Celiac disease, it is a digestive condition which occurs as a result when the gluten found in wheat, rye or barley causes inflammation of gut, thereby causing damage to the lining of small intestine and thereby leading to a malabsorption of macro and micronutrients. And the body's inability to absorb these micronutrients causes deficiencies which affect your brain, liver, nervous system, bones and other systems. And my topic, dear friends, unexplained infertility, reproductive problems and even the menstrual problems are increased in people with gluten intolerance. In fact, I would dare say that celiac disease should be considered and screening tests should be performed on women with menstrual and the reproductive problems. The testing for celiac disease not only provides an opportunity to increase the possibility of a conception in uncomplicated pregnancy, but also improves the overall health. Gluten sensitivity may cause anemia, abdominal pain, bloating, gas, depression, diarrhea, fatigue, but it may not be as severe as celiac disease. Collagenous sprue is a condition in which there is a severe celiac disease which is refractory to therapy, and it's characterized by a depletion of collagen in the subepithelial regions of small intestine with thickness greater than 10 mm. And the prognosis of collagenous sprue is very, very bad. Gluten is a specific protein not only found in wheat, rye and barley and to a certain extent oats. It is a binding agent, like I said, for the dough. It gives elasticity and it causes the dough to rise. Gluten itself does not cause a nutritional deficiency. There are lots of health benefits to be gained from things containing gluten because they contain fibers. They make us feel full and prevents our craving. I've said gluten, wheat containing gluten is an impostor food. It is a fake food. It is a genetically modified food. It is an imitation food. It messes up with our genetic code, and our infinitely intelligent immune system make a valiant effort to get rid of it. And that process of getting rid of gluten causes many symptoms, and that is why most of the people come with most exotic names of the diseases that never existed before. This genetically re-engineered wheat causes lots of damage to the human body because of myriads of proteins which never existed before, and our immune system tries to get rid of it. The green food revolution which took place in around roughly about 1960s to 70s is one to blame for the inflammation and the glycemic spike. We say we are the diabetic capital of the world, India, but we are also the most wheat consuming population in the world. Wheat flour, maida, we consume the maximum amount, and as a result, these things happen. There is a difference between gluten intolerance and wheat allergy though. Wheat allergy is basically an IgE immunity antibody, which might not only be reaction to the albumin, globulin, but also to the gluten and glutenins. Answer lies in organic wheat. Organic wheat means they usually use less pesticides, and they have found a way to balance with the low level of pesticide. The problem with the use of organic wheat is that the poor farmer who is growing organic wheat has got less produce. So ultimately he earns less. But the answer is use of an organic wheat if you do want to eat wheat. Otherwise, I would not like anybody to eat wheat. May month was a World Celiac Awareness Month. Celiac disease is a multi-system, multifactorial disorder which involves a genetically predisposed individual. I'll come to that point, genetically predisposed individual with an environmental exposure of a small intestinal mucosa to a foreign protein called as gluten. So genetically predisposed individual means they have an HLA-DQ2 or HLA-DQ8 in about 98% cases. So this predisposition has to be there. I'm talking about so much of gluten, you must be wondering why I'm not talking about the symptoms of gluten. What symptoms are caused by gluten? The better question would be, what symptoms are not caused by gluten? There is no system in the body which is left unaffected by gluten. It can cause diarrhea, constipation, abdominal pain, bloating, fatigue, brain fog, anemia, joint pain, skin diseases, rash, depression, anxiety, you name anything. Wheat allergy, however, is different. It causes itchiness or the swelling of lips. It is different. Dermatitis herpetiformis is the itchiest rash imaginable, which is because of wheat. If you are having unexplained itchiness, unexplained papules, reddened skin, multiple small bumps, especially the extension in the backs, they might be because of gluten. All the bowel diseases, the inflammatory bowel diseases, ulcerative colitis, Crohn's disease, they are exacerbated by the gluten. Even the brain and the nervous system disorders like schizophrenia, Alzheimer's, even attention deficit hyperactivity disorders, they are affected by gluten. The joints and the swellings, many people, they complain about joint pains. It is exacerbated by gluten. The skin conditions are likely to improve if the gluten is avoided from the diet. There is a difference between gluten sensitivity and celiac disease. Celiac disease is a more severe, acute. Gluten sensitivity is less severe. In gluten sensitivity, there is no damage to the small intestine, or the damage is less than Marsh grade 2, which I'll come to it later on. And it is not an autoimmune disorder. The autoimmune, it is managed by the innate immunity. They lack histological lesions. The genetically predisposed, I have already told that if we do HLA-DQ typing, then HLA-DQ2 or HLA-DQ8 are found in almost 98% of the cases. HLA-DQ 7.5 is found in 1.6% of cases. So, gluten sensitivity or gluten intolerance or celiac disease occurs in a genetically predisposed individuals. Like I've said, the problems are on a spectrum. The celiac end of spectrum is very severe. The sensitivity end of spectrum is mild, and most of the people have somewhere symptoms in between. The severity of symptoms depend upon when the gluten was introduced to a particular person, at what age, how long were they breastfed, how much length of the intestine is affected. All these things, they affect the symptoms of this thing. There are more than 300 symptoms which are attributed to the gluten sensitivity and celiac disease. Sometimes the telltale gastrointestinal symptoms may not be apparent, and there are 9 diverse signs which may indicate that you might well have an intolerance to gluten. If you have a dysfunctional digestion, the flatulence, the abdominal pain, the heaviness of abdomen. If you have an intractable dandruff, yes, intractable dandruff, that itchy, scratchable rash, the itchiest rash unimaginable, the foggy brain, you feel confused all the time, you cannot concentrate. You have migraines, pounding headaches after eating meal. You have sensation of pins and needles in your palms and legs. You cannot concentrate, you have an attention deficit, or you are not feeling well, you are depressed, you are irritable. And most important in our female patients, they have reproductive problems, infertility, menstrual problems. If these 9 issues are there, then you should consider getting tested for. Like I mentioned, our gut contains almost more than 90% of the immune system. And when the gluten damages our small intestine, it not only damages the small intestine, the secretory IgA which is there in the small intestine also gets damaged. And as a result, all the mucosal lining which are connected to the outer world, the eyes, the nose, the mouth, the GI tract, the urinary tract, the vagina, everything gets affected, and the local immunity is affected. So anybody who is suffering from recurrent cold, flu, sinus infection, eye infection, vaginal infection, urinary tract infection, or even the recurrent abdominal gut infections of Giardia and H. pylori should consider the gluten intolerance. Even the chronic fatigue, lethargy, unwell, lack of motivation, lack of energy is because of gluten. Any degree of gluten intolerance means your body's immune system responds inappropriately to the gluten in the food it wants to get that gluten out, because gluten causes the damage to the intestinal lining and thereby the body's ability to metabolize and absorb the nutrients properly, and it results in the various degrees of malnutrition. As a result, the iron, calcium, vitamin D, magnesium, vitamin B12, everything is less. Now you understand why almost everybody, a couple of years back, a report in Times of India said more than 97 and 95% people in India are deficient in vitamin D and vitamin B12. This is the reason. Our wheat eating habits are the reason. Dermatitis herpetiformis, that is a cutaneous manifestation of an small intestinal mediated enteropathy which is precipitated by the exposure to gluten. It is characterized by the IgA deposits in dermo-epidermal junction, and it causes pruritic papillovascular rash that affects buttocks and extensor surfaces. So the moment you eat gluten containing grains, there is a cascade. Our body thinks gluten is hostile. It creates antibodies. There is a cascade of inflammation. This inflammation is perceived as a threat. Bowels are damaged because of the inflammation. There are cracks and fissures in the intestinal tracts. The lining of bowel, which is very thin to begin with, it gets now allows the passage of the material to pass through. As a result, various bacteria, various organisms, various proteins pass through, and they go into the blood system and the lymph node, and they cause havoc. It causes increased levels of zonulin. Even the people who are bald, who do not have hair or who are thinking of a hair transplant, please consider giving up gluten first, because there is a condition called as alopecia areata, in which there is an inflamed root hair follicle which makes it difficult for an individual to hold hair. So many people who complain that their hairs are falling, their hairs are weakening, they have plenty of hair which fall. It might well be because of gluten. Stop eating wheat. Maybe within 12 to 16 weeks you may regenerate your hair. So if I have to sum up the health issues which are caused by gluten or aggravated by gluten, it can be diarrhea, gas, bloating, nausea, constipation, inability to lose weight, chronic infections, snoring, chronic fatigue syndrome, irritable bowel syndrome, depression, skin disorders, osteoporosis, diabetes, hypothyroidism, autoimmunity, infertility, tingling, pins, needles in legs, the ulcers in mouths, the joint pains, the tingling sensation in head and bones. So you can say that gluten affects everything in the body. We human beings are basically very fond of even feeding the small newborn kid or an infant with wheat. The intestine of a newborn is very thin to begin with, and it is porous. God has made it porous so that the infant, when it drinks the mother's milk, the immunoglobulins from that mother's milk can pass through the intestine and provide the immunity to the baby. The moment we introduce gluten, or early introduction of gluten, it allows the passage of gluten through those porous channels. It goes into the body, it causes allergy and causes the gluten intolerance later on in the future. That is why most of the neonatologists and the pediatricians around the world, they recommend absolute breastfeeding only for first 6 to 8 months, and that is the reason. Gluten is a large protein. Not everybody creates antibody to the gluten, but everybody creates a different antibody to the different segments of gluten. Body can choose which segment of gluten molecule to create antibodies of, and that is why the antibodies vary from person to person. That is why the symptoms vary from person to person, and that is why the diagnosis is very, very difficult. Every grain has its own type of gluten. Fortunately, because of the less pesticide used in oats, the gluten intolerance is less. I've said so much about gluten. I must have so much about symptoms. The question arises, why does the gluten cause the symptoms? Gluten is a group of protein which is very difficult to digest. It is extremely resistant to the intestinal digestion. No amount of grinding, cooking, processing can digest gluten. Gluten is just not a protein, but it's a protein composite, composites of glutenin and gliadin. Gliadin is in wheat, secalin is in rye, hordelin is in barley, avenine is in oats. These are the elastic group of proteins which belong to a group of protein called as prolamins. This protein composite is insoluble in water and comes from an endosperm within the grass-related grains. This gluten causes the elasticity and a glue-like capacity, and it gives the wheat, the roti, a chewy texture. Oats, however, technically they are not gluten, but because they are harvested and processed alongside wheat, they can be easily cross-contaminated. They are virtually always cross-contaminated, because unless the oats are manufactured or they have a dedicated facility with gluten-free practices, all cereals and grains, including oats, should be considered contaminated with gluten. Grains may be contaminated with gluten by sharing of same farm, truck, mill, bagging facility, everything. So to be digested, gluten has to be broken many times, and we human beings do not have the right biological equipment to achieve its full digestion. Our bodies are not designed to digest wheat grains, the grass grains like wheat. It is only the any other birds like pigeons who have fully equipped system to digest gluten. In fact, the animals also, the grass grazing animals have evolved to digest the wheat because they have got 4 stomachs, which we unfortunately do not have. Small intestine breaks up proteins into the small chains of amino acids or small amino acids, and that is where the amino acids can be absorbed. However, gliadin is not broken into the small amino acids or the chains. There are longer polypeptide chains, and these polypeptide chains, because they pass through the abnormally permeable or leaky gut, and one of these longer chains of polypeptide is attaches to an enzyme called as tissue transglutaminase, and this sets off an immune cascade which leads to the not only damages the intestinal epithelial cells but also leads to the autoimmunity. Whenever gluten trigger is there, it basically causes our immune system to overreact with strong and unusual antibodies. Over a time, because of these antibodies, the intestinal villi are damaged and cause villus atrophy. Villi are finger-like projections which increase the surface area of the intestine, which helps in absorption. The combination of this absorption loss and inflammation causes a leaky gut syndrome, and this causes various immune issues. The length of time and the length of small intestine, which is affected by the loss of villi, varies from patient to patient. The length determines the severity of signs and symptoms. And that is why different people are exposed to different lengths of gluten exposure, different amounts of gluten exposure, and different lengths of small intestine which are exposed to the gluten. And that is why everybody has got different symptoms. Most common symptom for those people who have gluten intolerance is a bloating sensation right inside your stomach. Whenever beneath your ribs there is a bloating or a sensation. For those people who have got increased belching, it might well be a gluten intolerance. The two main proteins, like I said, alluded to, gliadins and glutenins. Gliadins are often called as protein with teeth. The two most important functions of small intestine, one is the absorption of the nutrients and second is filtering. From the absorption of these nutrients, it basically helps convert food into fuel. Fuel makes various absorption of the nutrients, and this makes our body work. And filtering, it basically screens all the non-absorbable proteins, all the microbes to get out of the intestine without leaking it. But because of the damage of the leaky caused by the gluten, causes leaky gut, and these proteins and viruses, instead of going out of the system, they go inside the system, in the blood, in the lymphatics, and they go into the body, different tissues, joints, brains, and that is why they cause damage. But our body is wonderful. One-off exposure to gluten, body can heal by itself. But the moment the capacity to heal is overridden by the continuous daily multiple exposures of gluten in a day by usage of bread, pasta, breakfast cereals, noodles, cookies, then it causes years of damage which cannot be healed. The exposure of our small intestine to the susceptible precipitates, that means those who have HLA, DQ2 and 8, causes an immune reaction which involves both an innate and an adaptive. The tissue transglutaminase, which is an enzyme present in the lamina propria of the small bowel, it deamidates glutamine residues in gluten to form glutamic acid. This glutamic acid is a negatively charged molecule which is recognized by the antigen presenting cells of the T cells with those who have HLA DQ2 or DQ8 receptors. And these T cells are activated, they divide rapidly, and they start forming various cytokines, interferons, tumor necrosis factors, interleukins 15, 17, which ultimately causes enterus, villus atrophy, and the autoimmune damage. So the only strict treatment to gluten sensitivity or celiac disease is a strict avoidance of wheat, no decrease in quantity of wheat. Even if you take 20 milligram of wheat per day, that is also can cause a gluten. Even when the celiac disease is in complete remission, for years there are activated neutrophils which are active and they can still erode the gut health. There is an increase in the rise of the zonulin protein, there is an increase in exposure of the gluten. And this zonulin protein causes cracks and fissures in the bowel wall which allow food, particles and bacteria to leak across the intestinal barrier and lead to a systemic inflammatory response which is responsible for all the inflammation across heart, brain, joints, digestive tract. I have said about so much about the gluten symptoms, but what is the connection between the gluten intolerance and infertility? Various studies have said because gluten intolerance causes an autoimmunity trigger, and most of the hypothyroid cases are because of the hypothyroid autoimmunity. There is about 43% of cases of celiac disease are associated with hypothyroidism, and because of the malabsorption of common nutrients, macro and micro, B12, folic acid, iron, it results in anemia. And anemia leads to an erratic menstrual cycle, missed ovulation and ovulation. In fact, gluten sensitivity should be screened for all the women presenting with reproductive disorders. And like I mentioned before, 5 to 8% cases of unexplained infertility are because of untreated, undiagnosed celiac disease. Gluten sensitive women have about 9 times increased chances of miscarriage compared to the women who do not have gluten sensitivity. There is increased chances of antiphospholipid syndrome. There is increased chances of 21% increased chance of pregnancy loss. The celiac disease, like I mentioned before, it is an autoimmune condition which is triggered by the ingestion of gluten containing food. In response to the dietary gluten, the body's immune system is triggered to release to such an extent that body starts damaging its own tissues in order to remove the offending gluten food. Over a period of time, this digestive tract, particularly small intestine, is destroyed. But celiac disease is much more than the intestinal lining. In males, it not only causes increase in FSH, increase in prolactin, which causes something called as an androgen insensitivity, it causes weight belly, and it causes lots of problems. Overweight men and women, they have got high estrogen and prolactin levels related to the visceral fat around the middle. And as a result, gluten-free food, gluten-free diet offers a low cost, low risk means to potentially improve fertility, conception and pregnancy. Most of the women with infertility, they did not have a typical intestinal problems, but most of them suffered from fatigue and anemia. Post-COVID, many people come to me and say that, sir, we have got unexplained weakness, unexplained fatigue. Avoid the wheat and almost 50% cases might be solved. Fertility problems could well indicate the early autoimmune problems, which is a hallmark of gluten intolerance. Atypical symptoms of celiac disease include delayed menarche, amenorrhea, early menopause, infertility, impotence, hypogonadism, recurrent abortions, preterm deliveries. So this nutritional, endocrine and autoimmune condition can make it difficult for a female to conceive. Not only they find it difficult to conceive, they even find it difficult to carry the pregnancy to the full term. As a result, miscarriages, preterm deliveries occur. In fact, unexplained infertility or silent, they may be the first sign of a silent or an undiagnosed celiac disease. There is an association between PCOD and pelvic inflammatory disease with gluten intolerance. Mild endometriosis have got a significant association with gluten intolerance, and gluten-free diet can go a long way in abating the symptoms or reducing the symptoms of endometriosis and PCOD. Any patient who has got a persistent miscarriage, infertility, where any other causes cannot be found, or unexplained infertility or an IVF failure, should be thoroughly investigated for celiac disease and should be compulsory put on a gluten-free diet. It is essential to bring the awareness of gluten sensitivity to the young couples. Many people think how much a little bread or a cake can hurt your fertility. It does. It can cause you 2 miscarriages, 3 years of married life without a child. So yes, gluten should be avoided. Now comes the most important question. Most of the people ask me how to diagnose this gluten intolerance. It can be diagnosed by the presence of antibodies which develop in reaction to the gluten, such as tissue transglutaminase, anti-endomysial antibody, and deamidated gliadin peptide. It is, however, possible for people to have gluten intolerance or celiac disease without the presence of these antibodies, and reverse is also possible. People may not have gluten intolerance or celiac disease, but these antibodies may also be possible. Why this is there? Because wheat contains about 6 proteins and we check only for one, that is gliadin. There are 5 others which are like wheat germ agglutinin, glutamorphin, glutenin, prodanophin or omega. A gluten assessment panel, it is called as a wheat or a gluten protein insensitivity and autoimmunity test. It basically looks for tissue transglutaminase antibody, which is the marker for the autoimmunity against intestinal disease. This marker strongly suggests celiac disease or an autoimmune reaction to the small intestine in response to the gluten. And presence of antibody to trans tissue glutaminase is one of the key markers of celiac disease, can negatively impact the placental development. This enzyme is found throughout the body, which repairs, remodels the tissues and is instrumental in forming the fetus. So an abnormal trans TTG could directly affect the woman's ability to carry a pregnancy, sustain a pregnancy. However, a negative test does not rule out the gluten allergy, because either the female may not have an immunity or female may be partially off gluten. So negative test does not rule out. So the most sensitive and specific serologic test is endomysial antibody IgA and human tissue transglutaminase antibody IgA HTTG. These are sensitive and specific in more than 80% of the cases. Gliadin antibodies can be diagnosed, but they are not that specific and sensitive. And a genetic marker test, like I alluded to before, HLA-DQ2 and HLA-DQ8 is present in about 30 to 40% of the cases that doesn't have a celiac. Other antibodies like deamidated like gliadin and anti-gliadin antibodies, however, identify the gluten sensitivity as well. But gluten sensitivity, like I said, is like a spectrum, is like a dimmer switch, is like an on and off switch, where celiac disease is an on setting and sensitivity is an off setting. Testing can be deceptive, and that is why for a confirmatory diagnosis, people go for an endoscopic biopsy of the small intestine in the duodenum part. And the histological spectrum of the intestinal spectrum, there is a Marsh 0, there is type 0, which has pre-infiltrative or normal. Marsh 1, type 1 is an infiltrative lesion with increased intraepithelial lymphocytes. Marsh type 2 is hyperplastic lesion, which has type 1 prescript hyperplasia. Type 3 is a destructive lesion with the type villus atrophy, and type 4, which is a hypoplastic lesion, which has a T cell lymphoma. Best way to find out whether you are gluten sensitive or not is to have an elimination diet for about 2 to 3 weeks, and if your symptoms clear up, that means you definitely have a gluten intolerance. In some people whom, in spite of doing everything, these antibodies are negative, but yes, there is a strong suspicion, then you can go for a gluten challenge and then do a serologic testing. But again, the diagnosis lies on the suspicion. If your energy levels are not as much after you eat your food, if you have to work harder to digest your food, if you are constantly irritated after eating your food, if you develop headaches after eating your food, if you have enough bloating and abdominal pain after eating food, might well consider your gluten. We have talked so much about gluten. Now the answer is, what is the treatment of this gluten? First of all, you have to avoid anything which contains wheat, rye and barley. Many people ask me if they can eat oats. Up to 50 grams of oat can be eaten, because oat is technically not a gluten containing food, but because it is harvested along with wheat, there is a maximal chances of oat being contaminated with gluten. So unless oat is harvested, bagged, milled, transported in a dedicated gluten-free facility, it should not be eaten. Many people have got gluten intolerance. They also have got a lactose intolerance, so you should avoid milk as well. Human beings are meant to drink only their mother's milk. You should not be drinking somebody else's milk, because there is a species variability. The antigenic problems may occur. We are not meant to drink somebody else's milk. You are meant to drink milk only till 2 years of age, that to our own mother's milk. If you want to drink milk, you drink coconut milk, almond milk, but do not drink cows, buffaloes or somebody else's milk. Adherence to a strict gluten-free diet is very, very important. Not even a single piece, single drop, single milligram or single microgram of gluten containing food should be taken. Avoidance of gluten-free, strict adherence of a gluten-free food will help in repair of the small intestine. However, the dramatic change in the probiotic populations of the women intestines during pregnancy is enough to trigger the gluten intolerance. And for some reason, any kind of an emotional trauma, surgical trauma, infection, pregnancy, delivery, surgery may trigger the gluten. The exact level at which the gluten is harmful for the people with celiac disease is uncertain. However, a systemic review in 2008 concluded that the consumption of less than 10 milligram, less than 10 milligram gluten is unlikely to cause a histological abnormalities. The goal of gluten-free diet is to maximally nourish your body for fertility, not simply replace gluten with starchy containing bunch of processed, pre-packaged, sugary, gluten-free foods. A gluten-free food is a great opportunity to give up the flour-based food, increase in intake of fruits, vegetables, whole grains, beans and good quality proteins. We need to avoid wheat, rye and barley. Oats can be technically taken, but you should keep it consumption less than 50 grams a day. In the books of Nutritional and Physical Degeneration by Dr. Winston Price, he outlines that dense nutritional foods are the need of the hour. He found that in women with childbearing years who had a nutritionally dense food, they had healthy children, zero infertility, zero problems, zero cavities, and they could conceive easily. It is my belief that everyone would benefit from a gluten-free food, even if they have no gluten intolerance or allergy symptoms. Many people who don't have gluten allergy, they can also eliminate gluten from their diet. It is very difficult to go off gluten though. First of all, you need to clean your kitchen of all the baking mixes, segregates, buy new condiments. Go to a total unprocessed food. You can try fresh meat, poultry, fish, vegetables, fruits. But I am strictly against commercially available gluten-free foods. When you're off gluten for 3 to 4 weeks, most of the symptoms, especially gastrointestinal symptoms like acidity, heartburn, flatulence, bleeding, abdominal discomfort, they show a tangible improvement. A marked improvement in other symptoms followed in next 2 to 3 months. However, it takes about 18 to 24 months for your body to get all the symptoms relief. But an accidental or an intentional exposure to a gluten again causes a flare-up for 2 to 3 weeks. So that exposure should not be there. Conclusion, I would like to say dairy should also be avoided because many people who have got gluten intolerance, they also have got lactose intolerance. Going gluten-free can be tough, but it is worth. Because blood glucose excursions caused by carbohydrates in grain products, people find it very difficult to leave gluten. They have a gnawing sense of hunger and hypoglycemia, and as a result, they have to go to the vegetables. Vegetables with real butter are much cheaper than whole grains. A diagnosis of gluten intolerance or a celiac disease should not be end of the world, but it should be the beginning of taking your charge of your health and improving your life. Life After Bread and Get Off Gluten and Reclaim Your Health in 2009 by Eddie Bauer, she writes that there are so many processed foods, but we can use gluten-free whole grains such as amaranth, rice, almond, coconut can be substituted. Many people who go off gluten, they might have initial weight loss, but they may ultimately regain weight because you may substitute the gluten by the use of other starch. Gluten-free diet is pretty much simple. You take fruits, vegetables, seeds, salads, nuts, meats and fish. No bread, cookies, cakes, pizzas, pastas, biscuits. Pseudo cereals, the millets which our Dr. Modi ji is promoting is very, very good. Quinoa, buckwheat, millets, amaranths, they are very, very good. I would not recommend even eating gluten. I am very passionate about gluten because for almost 40 years of my life, I found it very difficult. I have stopped eating wheat since last 7 years. I am trying to be on a strict gluten diet, and I firmly believe that infertility is in almost 15 to 20% cases related to gluten. Please like the video, please share the video, please subscribe to our channel. Namaskar, bye bye.